Ladies and gents, welcome back. We're having a situation with our hospitals in Canada. We have emergency rooms closing due to staff shortages. Yes, that's right. For our American partners out there, our Bernie bros that think that socialized medicine is the answer to everything, just have a look at what's happening in Canada. Now, these staff shortages have largely to do with, well, you guessed it, firing workers for not having the right medical status when it comes to the vaccine. Nonetheless, the media is actually starting to take notice of this, but are they really getting to the crux of the situation? Well, we'll just have a see here.
This is unbelievable. There was a time when we were all terrified because there wasn't enough PPE at the beginning of the pandemic, and we should have been. But now you can't even get into the ER or seen or a bed. Like, this is staggering beyond staggering. Why do we need to be reminded to be kind to the people that we spent many a night banging pots and pans saying frontline heroes, and then treating them so poorly? And guess what happens when you treat people poorly? They get burnt out and they leave.
See ya.
And here we sit.
We have a provincial government in this province that doesn't feel they need to even address this in front of open press. Remember this moment when no one did a damn thing. Our prime minister's in Costa Rica sunning himself. This is a national issue. Provinces deal with health. This is a national issue. Remember this moment, because in 10 days, we're going to have a big press conference where everyone's sitting there, Sylvia Jones, Premier Ford, and everyone's going to look real serious. And the way politicians typically come late to the party on this. This is happening in real time, okay? I don't care if you want a summer vacation. I don't care if you're tired. If you want another job, quit. I'm getting tired of this garbage. Every time something happens in this province, / this country, people are MIA because they don't want to deal with the tough issues. If you run for public office, this is what we need you for. If I got family, or you got family, or you got family, or anyone else here has family that needs something tonight, they're screwed.
Well, yeah, that is the case here in Canada. But here we have Ellen writing, it's not what they're saying. It's time to get the unjabbed back on the job. But the question is, are the unjabbed going to want to go back to the job even if they're offered that? It's not certain because people have moved on a year and a half without a job. You tend to move on. You go somewhere else. Now we have here Matt Strauss on MD on Twitter saying, remember when they said, if we close small businesses, reduce restaurant capacity, fire unvaccinated people, cancel funerals and weddings, masks children, close schools, and travel, we could save the healthcare system? And well, that's referring to this article where it's saying Montfort Hospital latest to temporarily close emergency department because of staff shortages. This is happening all over the country. We are seeing emergency rooms closing. Ottawa's Montfort Hospital was among the hospitals across Canada to close their emergency departments over the weekend, suggesting that the most acute effects of the country's shortage of nurses are starting to spread beyond smaller communities and into large urban centers. Montfort, which serves French speakers in Ottawa, shuts down its emergency department from 7:30 p.m. to 7:30 a.m. on both Saturday and Sunday. So if you are sick, you need medical attention, you cannot go to this hospital after 7:30 on the weekends. This is crazy because of what they called an unprecedented shortage of nurses, in quotes, caused by work absences related to COVID-19 infections, fatigues, and vacations. Okay, they don't get into what may be the leading cause here. Here's back in October 26, 2021, right here in my province of British Columbia, more than 4,000 healthcare workers remain unvaccinated, says province's health minister. They later had to give those people the boot. They had to give them the boot. What do we have here? We have from the financialpost.com. Thousands of unvaccinated Canadian employees are being fired or put on leave, squeezing the already tight labor market. Workers whose livelihoods are on the line are flooding labor lawyers with calls. And this is back in November 3rd of 2021. So yeah, there's a lot of emotion flying out there, and people are frustrated with our healthcare system and the state of it, but they're ignoring largely the main culprit here, and the main cause is that you cannot just fire thousands and thousands of people in an industry and expect the industry to be able to function. This is just it's unbelievable that the news isn't not even talking about that. They're talking about PPE. They're talking about people being tired, people needing vacations. Yeah, all of that's true. But you're talking about half the workforce trying to cover for the other half that's absent because of bad policy. Bad policy is the name of the game here. And we all know that these people should be brought back. But most of them are, well, in most cases, they've either moved on or they just don't trust that they'll still have their job in a few months when the new thing hits. And even if you are vaccinated with the first 2 shots, it is now considered, we don't say fully vaccinated anymore in Canada. We now have the new language, the new Orwellian language of up to date, which means you have to have had a booster in at least the last 9 months. And that will be the precedent setting moving forward. Yes, the mandates have been suspended, but that is a suspension of a thing that is now going to be a permanent infrastructure in our country. So expect more shortages of labor in the medical system, because with policies like this, this is just the way it's going to go. Anyway, that's all I got for you this morning. We'll see you in the next video. Keep on trucking.